Hi, my name's Catherine Simpson and I'm a Museum Collections Assistant at the Shakespeare Birthplace Trust in Stratford-upon-Avon. I'm giving today's Shakespeare on Show blog, which is a series of blogs about free exhibitions that are running across the Shakespeare Birthplace Trust. Today I'm going to be talking about this medicine chest, which is on display in the Stratford room at the Shakespeare Centre on Henley Street. This beautiful medicine chest dates from either the late 16th or the early 17th century, and as the name suggests, was probably being used by a medical practitioner. The top of the chest, which unfortunately you can't see at the moment, is decorated with a parquetry design, and then inside the lid is this black on white block printed armorial paper. And this has a series of symbols from the period, including the Tudor Royal Coat of Arms, Tudor roses, the monogram ER, which undoubtedly would have stood for Elizabeth I, and other symbols such as masks and pomegranates. Now, as mentioned, as you can see at the front, there are a series of drawers, 9 drawers, and within the chest are also 15 further compartments. And within all these compartments would have been the tools of a medical practitioner's trade, such as oils, herbs, ointments, leeches, saws, syringes, you name it, they would have been in there. Now, as mentioned, this would have been used by a medical practitioner. The medical practitioner would have carried it around with all his tools and taken it to see his patients. However, medical care in the Elizabethan age was very different from our age. If you fell ill in the Elizabethan age, you could go to see one of 3 people. The first was an apothecary, and rather like our modern day chemists, they would have made and dispensed medicine, and they may also have given advice as well. The second was a physician. Now, physician was more academic. They studied medicine as laid down by the ancient Greeks, and often would not even see a patient when diagnosing them. And then there was the barber surgeons. Now, the surgeons carried out operations, and this included amputating diseased limbs, pulling teeth, but they were also barbers. They also cut hair, hence the term barber surgeons. Unfortunately, healthcare wasn't quite as advanced as it is today as well. Medical practice was based on the theory of 4 humours, and that was yellow bile, black bile, phlegm, and blood. And it was basically believed that if you were ill, then the humours within your body were out of balance. And in order to restore health, you needed to restore the balance. So therefore, the practitioner would have carried in this case instruments that would have helped to restore this balance. For example, if you had a fever, it was thought because you had an excess of blood in your body, which is one of the humours. And therefore, to cure this, you needed to bleed the patient to remove some of this blood. Hence, in this case, would have been carried leeches, or scalpels, in which to cut the person's skin and remove the blood. But there was also a range of strange and marvellous medicines. For example, if you wanted to cure earache, you might mix the gall of a hare with the scent of a fox and then place it directly in the ear. There was this odd belief that you could cure whooping cough by giving a ferret some milk to drink and then feeding the rest to the person with whooping cough. So you can imagine what was carried in this chest. And one final interesting fact to note is that sometimes physicians would have carried a urine flask. People thought you could cure everything by looking at somebody's urine. So basically the patient would have urinated into the flask, and then the physician would have held it up to the light, taken a look at the urine. He would then have smelled the urine, and then worst of all, he would have stuck his finger in and tasted it. And from that, he would diagnose how you were. So yeah, please do come and look at this beautiful chest because it is